Hello and welcome to the programme. Will they? Won't they? If they will, when? If not, why not? It may be confusing, but deciding whether to lift all COVID restrictions in the UK and elsewhere is anything but simple. For people in England, Freedom Day was supposed to be here by now. Now it's been put off again until next month at the earliest. Where's the evidence for yet another delay? Very good to have your company. I'm David Foster. The sun has been out, so too people on the beaches and in parks. So even with restrictions continuing, are the people listening? How do you persuade the skeptics? June the 21st had been signposted as the end of all lockdowns and restrictions in England, but concerns over the resurgence of COVID prompted a rethink. Case numbers were rising, and the UK Prime Minister Boris Johnson announced that so-called Freedom Day would be postponed by another 4 weeks. Under the new plan, social distancing rules and limits on the size of indoor gatherings will remain in place. The delay will also mean that limits on numbers allowed into arenas, cinemas, sporting events and theatres will stay for now. The rise in cases has been down to the Delta variant, which is up to 80% more infectious than the original strain. And with the threat of other mutations emerging, how close is the UK to being COVID-free? And will some of the changes we've experienced be permanent? I'm very pleased to say that we can introduce at this round table from Edinburgh, Aziz Sheikh, who's director of the Usher Institute at the University of Edinburgh. Then in London, we welcome back Oksana Pyzik, Global Health Advisor and Lecturer at the UCL School of Pharmacy. Then to the South Coast, Southampton in the UK, Dr. Simon Kolstoe, Senior Lecturer in Evidence-Based Healthcare at the University of Portsmouth. Very good to have you all with us. Aziz, I'm going to come to you last of all because you're going to talk about a programme that the government took into account when making its decision. So, Oksana in a moment, but first of all you, Simon. This is about making sure that hospitals can cope rather than eliminating the virus. And it was always going to be that way, wasn't it?
Absolutely. So the most important thing that we're concerned about is whether or not hospitals and in the UK, the NHS are likely to be overrun by COVID patients. So although we see lots of statistics about the numbers of community infections, in a way it doesn't really matter how many people are sick in the community so long as the hospitals are able to cope. And so what we're hoping is that with higher vaccination rates, we see this break between the number of infections in the community and the number of hospital admissions. And so, of course, the big question is, have we got the vaccination rates high enough to see that break, or do we just need to pause and continue a lockdown for a little bit longer until we can allow the vaccination to really sever that connection between
and your thought on that is that it will go beyond July the 19th or not? Or can you not say?
It's difficult. And to a certain extent, I think it depends upon vaccine uptake. Certainly the statistics I have seen is that by extending by another 4 weeks, we'll see about another 10% of the adult population receive their first vaccination and another 20% receive their second vaccination. And hopefully that will be enough to break that connection.
Oksana, people are getting a little tired of this. Is there any evidence that they are worried about the fact that it seems to be going on and on and on and on, and therefore they're paying less attention to the restrictions?
Well, I certainly think that it is a challenge to communicate the dangers around particularly this new Delta or aka Indian variant and keep high levels of compliance to sort of the current. What we have is a lot more freedom than previously, but there are some restrictions still in place. However, the government argued previously that people would tire of certain restrictions and use that as a justification to not bring them in, to delay bringing them in. So I think it's an error to do that, as long as there is consistent and clear communication around the fact that there could be an increase in hospitalizations due to the features of this particular variant, up to twice as many.
Okay. Aziz, let me ask you, you're in Edinburgh, you conducted with others a study across the whole of Scotland, or as much as you were able to, called EVE, E-A-V-E, 2, which is the early estimation of vaccine and antiviral effectiveness. The government took this into account when making its decision. What was your sense of the most important thing that you told them?
Yeah, so I mean, this covers the entire Scottish population, so I think we're in an incredibly privileged position to have an end-to-end look at what's happening with COVID-19 across the entire population in near real time. The key evidence that we put before decision makers was that, one, the Delta variant is now the dominant form in Scotland. I mean, it's actually taken hold incredibly rapidly. So over a matter of weeks, it's emerged as the dominant, with around 3/4 of all cases of the Delta variant in Scotland. The second issue was that the Delta was associated with an approximately 85% increase in the risk of hospitalizations from COVID-19. That's when compared with the Alpha or the Kent variant. So a very substantive increase in risk. The third sort of key piece of evidence that we were able to put forward was that vaccines still work, thankfully. That's incredibly important. So we are seeing protective effects against risk of hospitalizations, but those effects seem to be a bit more delayed when compared with the Alpha variant. And we're seeing less protection against the risk of infection. So they're still working, but they seem to be taking a bit longer to work, and at least for infections, a bit of a reduced effect. And so really, I mean, the kind of key bit of the equation here is that by delaying the kind of lifting of restrictions gives us the opportunity to vaccinate more people, in particular, get more second doses into arms. And I think that's going to be really important going forward.
Aziz, there you're talking about the Kent, the Alpha variant, and the Delta, the Indian variant. And I've got a chart here that I'm going to be consulting. It'll come up on the screen in full in just a second. But let me read you off a couple of things that I've noticed here. Beginning of April, it looked as though the Kent variant was on the way down and there was no sign of any other one. Then suddenly up pops the Delta, the Indian. And by the end of May, the Delta Indian variant seems to have completely crushed the Kent one, the old variant. So my question is, did Delta actually get rid of Alpha, or did we almost beat Alpha only to be overtaken by this new variant?
Yeah, well, I mean, I think it's a difficult question to answer, but I think, I mean, you're absolutely right. It's taken hold incredibly rapidly. So by the 19th of May, over 50% of cases in Scotland, across the entirety of Scotland, were the Delta variant. I mean, it's happened at pace in England as well. And I was just speaking with colleagues from Wales and Northern Ireland, and it's sort of progressing very rapidly there as well. So, yeah, I mean, it's taking hold across the whole of the UK, unfortunately.
Simon, let me continue on the same theme with you, because my point is, if we have a variant, the Indian one, that is so strong, it is actually pushing the Alpha one away, isn't there a chance if we beat the Delta one, there's going to be another stronger variant that comes along, and it's a never-ending circle?
Absolutely. And I think it would be foolishness to think that we're going to defeat COVID and never see it again. I think part of the nature of these diseases, part of the way that natural selection works, is that there are always going to be new variants. And I think what we're going to find is, much like we see with influenza, every year we're going to need a new COVID jab that will be designed for whichever variant is most dominant that year. And we'll just become used to having a jab every year against COVID, because, you know, we can't really fight natural selection. It's kind of the way the world works. And we just need to come to terms with having COVID as a disease that we just learn to live with and learn to manage.
So somebody at the very top in the government, listening to what Aziz had to say, along with others, would have thought, hang on, okay, this is never going to go away. We have to come to what some people might say is an acceptable level of mortality with this, as we have done with influenza. Changes every year, but a great many people die of it. That's a very difficult conversation to have, but undoubtedly it happened, hasn't it?
I think we see this with lots of different cases. I mean, you could take non-medical things like car crashes or accidents that happen. You know, we get used to living with a certain level of risk. Now, it just so happens that COVID has come on the scene, coronavirus has come on the scene almost like an explosion, and it's going to take, or it has taken, a couple of years to get to grips with it. But it's just going to be one of these things. We live with risk all around us, and coronavirus will just be another one of these risks that we take and that we learn to live with as just part of our everyday existence.
Oksana, your thoughts there?
Without having vaccines, we have had huge number of deaths in the UK and globally. But vaccines, the regulations, restrictions that were in place right now here in the UK, in Europe, and other countries in the world are because we're trying to get to that threshold level. So once we do have these booster jabs available and a certain, let's say, a herd immunity within the population, then yes, then it is easier to live with. But until we reach that point, we are allowing for new variants to enter via whether that's border control issues. So again, this whole traffic light system, which has been heavily criticized here in the UK, which allowed the Delta variant to be imported into the country, as well as just allowing a certain high number of community transmission to occur, that also allows for other variants to arise, and potentially in the future we could see more and more vaccine escape occurring. So while we hope that science will be able to outpace evolution in the sense of the virus, we are playing a dangerous game by not thinking of this as holistically. So yes, vaccines are part of the equation, but we should be doing something now in schools and offices and other buildings to improve ventilation, to get that technology up with filtration and improvements in the quality of airflow. That hasn't really been discussed extensively in the UK or in many other countries.
So what do you think of my non-medical supposition that the Delta variant, which is crushing the Alpha variant or pushing it away because it's that much more transmissible, will be replaced by something even worse, and that even worse thing will be replaced by something even worse than that? Can we always stay a couple of steps ahead?
The Delta variant has really taken us back to peak February levels in terms of number of cases. So that's now even with wider amount of vaccine coverage. But I do think what we'll see, as our other panelists have highlighted, is that there is going to be eventually a break in which the vaccines will be so effective and so widely taken up that we'll see in the future that although there are going to be COVID deaths, it's going to be hopefully more along the lines of what we see every year from flu.
Yeah, that's what we were just talking about. Aziz, let me come to you. Another thing I picked up from your study was that younger people, younger members of the population were more susceptible to this new variant and more affluent, or people from more affluent backgrounds, whereas previously it's been older people from poorer backgrounds. What do you make of that?
Yeah, so I think younger people, predominantly because these individuals haven't been vaccinated yet, so vaccines do protect, and this is why I think they're more susceptible. In terms of affluence, I mean, it's difficult to say, but it could be something to do with travel. We know from data from Public Health England that those from South Asian backgrounds are sort of predominantly been affected by the Delta variant, so it could be something to do with the fact that these are individuals who are well enough to be travelling. I think it's really to do with how it's seeded in the community and then the pattern of spread. But we're now seeing a pattern such that really it's kind of completely replacing the Alpha variant as previously mentioned.
So it's not because it is more likely to target the younger and more affluent, it's that they are less protected than other members of the population, yeah?
Yeah, probably, yes.
Okay, I want to hear the words of Boris Johnson here on why he is so concerned, and then I'll have a question off the back of that.
And that's why we're so concerned by the Delta variant that is now spreading faster than the third wave that was predicted in the February roadmap. We're seeing cases growing by about 64% per week, and in the worst affected areas, it's doubling every week. And the average number of people being admitted to hospital in England has increased by 50% week on week and by 61% in the northwest, which may be the shape of things to come.
So he talks there about it being up by 64% in some areas, 50% elsewhere, 61% in the northeast, and that was why he put the brakes on. Is there anything, Aziz, and indeed I'll come to you other two in just a moment, that makes you think he could be looking at the figures as of today and having something to look forward to?
What's happening behind the scenes are there's forecasting going on, so there's modelling of what the pandemic will look like over the next few weeks. That's happening across the entirety of the UK. And the key consideration is if we carry on as we're currently doing, with the same patterns, are we likely to breach NHS surge capacity? So I think that's the underlying concern. But at the moment, we are in a phase of exponential growth. So we're seeing increasing numbers of infections. There is a weaker link with hospitalizations, but hospitalizations are increasing. And I think hence the decision to put the brakes on for a bit longer was the right decision, because it gives us the opportunity to play a bit of catch up with the Delta form.
Oksana, if we are going to see something that is never going to go away and we have to learn to live with it in certain ways, will one of those means of coping with it be that our social habits change, that we will get more and more used to wearing masks day in, day out, staying maybe 2 meters away from anybody, no longer shaking hands with people? Goodness me, I can't remember last time I did that. But will it become the norm?
Well, I think particularly around things like travel, certain East Asian cultures had already taken up the habit of wearing face masks on long-haul flights and while traveling, etc. People may feel that in an airplane where there isn't necessarily as good airflow, to take those self-protective measures. I think that it's difficult to say at this stage, given that we haven't beat it yet, despite many countries declaring victory. Modi in India only to have a devastating second wave. Then in Russia, Putin also saying, we beat it. And now we've got another surge in lockdown in Moscow. So really, I think if we're going to look at this problem globally, vaccination really does need to reach the low-income countries as fast as possible to improve our domestic situation as well. It's all interlinked. So those habits that you're referring to, hugs, handshakes, all of these are more likely to return once other countries are also vaccinated. However, at the current rate, because of IP restrictions on trade, it's going to take many years for those countries to reach the same level of vaccination that we have here in the UK and in Europe.
Simon, what do you reckon? You're going to give up backslapping and hugging your friends when you go down the pub or off to watch a football or cricket match? Or will we ease back into that?
I have to admit, I'm a cricket coach and of a junior cricket team, and we got to the end of the game the other day, and we almost had to physically keep the two teams of children apart to stop them high-fiving and shaking hands. It feels really unnatural to stop, especially children, doing those sorts of things. So I'm convinced that once we get back on top of this disease, we'll see these things come about again. What I do think we'll also see is things like face masks being worn perhaps when people have a cold. You quite often see in Asian cultures, if someone has a cold and they have to go out, they'll wear a face mask out of respect for other people. And so I think we might see things like face masks becoming more of a norm when you have a cold and you want to maybe prevent giving it to other people. But I certainly see things like high-fiving after cricket games coming back pretty much as soon as it's possible, because I think we're humans, we're so used to interacting with each other that that's not something that will have suddenly become extinct just based on the experience of the last year or so.
Since we got on to cricket, what do you make of the fact that the Prime Minister once said a cricket ball was the perfect vector for carrying the disease, and they still have to sanitise it every time an umpire or a player or a member of the crowd touches it?
Absolutely. That incensed me so much that I wrote an article for a news outlet looking at the evidence and doing a sort of rapid review of the evidence for this. And I think for anyone who's worked with viruses, these things, they get killed in UV light, they get killed in the sun. So if you're outdoors on a cricket pitch, yes, of course, spitting on a cricket ball is a silly thing to do. You know, I suggested maybe polishing it with hand sanitizer instead. But when you're outside and when there's bright sunlight out there, a cricket ball is not going to spread coronavirus.
I don't know. That stuff's quite sticky, and you can polish the ball and make it move all over the place. Aziz, how do you think people's personal habits will change?
Yeah, I mean, I think I largely concur. I mean, I think some of these non-pharmacological interventions that we're talking about, face masks, will probably continue. I mean, they are routine in many cultures already. I think certainly when we got infections in the past, we tended to kind of have a stiff upper lip and go into workplaces. I mean, that is not eminently sensible at all. I think we need to be doing far more in general practices in hospitals to isolate those with potential infections, so we're not sort of transmitting those. But I do hope that once we have populations vaccinated, and particularly with the second doses, then at least some of the physical contact that we all crave will return to normal.
So, Aziz, you've got the government prepared to accept a certain level of mortality. How do you know when the public has reached the same point?
Well, I think overall the public has thus far been I think very understanding. I think that's in part because, these risks have been communicated in pretty transparent fashion. So the underpinning research that is available, anybody can have a look at that. But I accept your point, because how long can this carry on for? I think we have to take the public with us. These surveys that are happening in the background, the focus groups, I think are really important. And at some point, as the other contributors have mentioned, we're going to learn to have to live with this and say this is an acceptable level of risk. I'd much rather that be once people have been vaccinated with their second doses, though.
Thanks very much. I'm going to go to Oksana and Simon now and ask about the fact that when there was a survey, Boris Johnson having announced there'd be another delay in lifting the lockdown procedures, I think it was 80% of people said, yeah, I'm absolutely fine with that. And Aziz has just mentioned the fact that people seem to be going along with what's happening. Are you both, and this is for you first, Oksana, pleasantly surprised at the fact that people seem to be quite happy, well, not happy, quite prepared to go along with what they're being told? And do you think that will last forever?
Well, I think there is a strong sense of personal responsibility within the citizens during this pandemic. And in this instance, we see that the original date of June 21st as Freedom Day is abandoning all restrictions. Whereas, currently what we're being asked to do is not anywhere near as restrictive as what we've experienced from Christmas until May, which was a very long stretch for many. But now we are able to enjoy company with friends and family, and businesses being open and travel resuming. So from that instance, I think people see this as a small compromise. They understand that actually only 40% of the UK population has had 2 doses of their vaccines, and that if you're running a marathon and there's only a few kilometers left to go, it would be silly to abandon it altogether. And I think there has been a strong sense of pride around the NHS, and that we all have our bit to do to protect it. So in that sense, I think although there are, of course, fringe groups who oppose restrictions, who oppose vaccines, etc., there's always going to be some level of dissent. But the vast majority of individuals do want to protect themselves, their families, and the most vulnerable in society. And I think, what is society without ensuring that we have this fabric of support available for people?
I'll take the marathon analogy a stage further and say, imagine if you're just rounding the last corner on your marathon and somebody holds up a sign and says, look, would you mind finishing off a triathlon once you've done this run? There's got to come a time, Simon, when people feel exhausted by it all.
Certainly, anecdotally, based upon my friends and family, I think people's acceptance is very much linked to how much it has personally affected them. So if they have close friends or family who are maybe suffering from long COVID, or they know someone who's died, I think they're more likely to take it a lot more seriously and be prepared to make more sacrifices than perhaps someone who works in, say, the wedding industry and is just absolutely desperate to get out there and get back to work. So I think we have to look at people's personal situations. And I think when we get to the point that more people see a reason for all the lockdowns to stop and for them to be able to get back to doing what they normally are doing, and that number of people overcomes the number of people who are perhaps nervous because of the negative ways COVID has affected them, I think that's when we'll see public opinion changing. So I think we really, really need to take account of how this has affected people personally in trying to gauge what this public opinion is.
And how long do you think it will be before we arrive, not at the lifting of the restrictions, but at that point when society says, OK, this is something we can deal with, this is something we can live with, and unfortunately some people will die with? How long do you think, Simon, you first, and then Oksana, you to wrap up, that it'll be before that point is reached?
I think so long as we have effective vaccines, as long as we've got data that shows the vaccines are working and they're able to defeat whatever variant happens to be dominant, I think people will be confident. I think as soon as a variant comes about and the vaccines start to look less effective, things might then go to push the other way.
Quick one, Oksana.
I absolutely echo my colleagues' words here. I think that it is, we finish the race, whether it's the marathon or a triathlon, via vaccines. That's what will protect us from further disruption as well as severe disease. So I think that hopefully we can, with supplies, etc., find ways not only to deal with the situation in the UK, which could be as soon as we say, over the summer period, but globally, again, I think we need to look beyond just the UK here and also ensure that we vaccinate the world and look at what's needed for that.
Oksana, very fair point, and we've done programmes about it here on Roundtable. I want to say thank you to all three of you. Aziz, thanks for your contribution. Thank you very much. Simon as well. And wherever you happen to be watching this edition of Roundtable, we say thank you to you. Join us next time if you can. Until then, from me, David Foster, and the team, goodbye.